again for intensive treatment. We're not going to shake our finger at them and say that you're bad or whatever. We actually plan for that and expect that. And what that got me to thinking about is this idea in our society and culture about substance abuse and addictions, and how we do a lot more than often shake our finger at people, that we actually imprison people because of issues that really are in many ways an illness. So let's kind of talk about that and where that's at, because I'm sure that our viewers have some trouble trying to make sense out of, if this is a disease, why aren't we treating it? Why, in fact, are we often putting people in prison? There's been a lot of talk, certainly in Baltimore City, about treatment on demand, treatment on request, but we know that there are a lot more addicts than there are slots for treatment.
Yeah.
And so this is a really kind of complicated problem, but we're still locking up addicts. What's that about?
Yeah, it's really, I'm glad you've raised that as an issue, because I think it ought to be of concern to all of us. We're spending about $40 billion a year incarcerating individuals in this country, and when you look at the numbers, there's been a fourfold increase in people in prison since 1980. We now have over 2 million people that are in jails and prisons in this country, and we've got the dubious distinction of having the highest incarceration rate per capita of any country in the world. And when you look at why is that happening, you have to stare squarely at our drug policy. We've declared war on drugs. We've got politicians that get to their seats by pledging to round them up and lock them up, and they've done that. The sad thing about it is that it really doesn't address the core issue, which is the disease of addiction, and that while people are in jail and prison, they often don't have access to treatment that might allow them, when they get out, to make better choices and follow a recovery path, and then they are in a revolving door circumstance where they come back and forth. So that we've spent an awful lot of money in this country on interdiction. That is, let's stop the flow of drugs into this country, let's see if we can keep it from being imported in, and have a paltry amount of money that's available for treatment. We haven't done anything to affect the flow of drugs into the country, despite the billions that we spent on that. And yet, as you said, we have waiting lists a mile long for people that are trying to access the care that works. There's something wrong about that, in my opinion. I take a public health perspective rather than a law and order perspective, and that when one has a disease that is also treatable and preventable, that one ought to put their money there. But we haven't done that as a society, and I think it's important for all of us to ask why of our elected leaders.
Well, it's interesting because what we hear about very often is that if people are seen as supporting drug treatment as politicians and leaders, that if they're seen as that, they're seen as being soft on crime.
Correct.
Because of the obvious relationship that there is between addictions and substance abuse and certain criminal, activities and behaviors. And so that's one of the things. But I saw an interesting piece on C-SPAN some months ago, and it's always stuck in my mind, especially because it was a judge. And this was a judge talking about the fact that we could, from now till the cows come home, put all kinds of funding into building prisons, and it really would not get at this issue, that what we really needed to do was to put money into treatment. And the calls that came in were very, very critical of this stance. And so we really are a long way from recognizing, I think, the illness, or accepting the illness aspects of this issue.
Yeah, I actually think that the judges of our country have a very important seat to view this whole phenomena from, and they have seen punishment not work time and time again. And there's a growing sense among judges of a concept called therapeutic jurisprudence, which is perhaps from the bench I can affect change that might improve people. And the way they're exercising this through the proliferation of drug courts. We have drug courts in this country that are now over 1,700, and that there are policies that have a defendant come before the judge, arrested for a drug-related charge, and rather than get sent to jail, the judge orders treatment for them. And those have been shown to be very effective in getting people hooked up and accessing the care that they need. It does run square into the resource issue again, though, because oftentimes the drug treatment that's mandated isn't available within those community settings. But we've got a growing database, again, to support that this concept of treat them rather than jail them is going to produce the type of results that we all want for our communities. It improves public safety. It takes care of many of the issues related to crime in our neighborhoods and the huge human toll it takes.
Well, let me just throw in another thing just to kind of make the discussion even more complicated, if we can possibly do that. But what about the issues related to mental health, mental illness? I mean, one of the things that you and I have talked about in the past has been that, to some extent, the idea of where the client or patient or consumer of service winds up landing, whichever system, is pretty much artificial. That, you know, we know that we have people with significant substance abuse problems in the mental health system getting treatment. We know that we have, you know, the reverse as well. And so what about that? Because clearly those are resource issues as well. The substance abuse treatment resources are not growing significantly. I mean, I think there have been some attempts, but I'm not seeing major funding of those things. The mental health treatment system is absolutely overrun, but even our own data in Maryland, we know that somewhere in the neighborhood of 70 to 75% of people in our public mental health system have a significant substance abuse issue or involvement. I mean, this gets real complicated and real tough.
Yeah, it is, and it's increasingly why we in the field, those of us that are thinking about both addictions and mental illness, talk about ourselves as behavioral health providers rather than an addiction provider or a mental health provider, because the two issues are so intertwined, and that it is very, very difficult, particularly at the front end in assessment, to determine the relative contributions of drugs and alcohol versus mental illness to the behavior and the thinking and the mood that might be disordered for an individual. So we're increasingly, as a policy direction, talking about no wrong door. That is, if you come in and you ask for help, you ought to be able to get it, whether you land in an addiction facility or a mental health facility or an ER or even in your primary care physician's office.
But Fred, you know as well as I do, and this is where I have to step back for a minute and put on my administrator hat, that when I'm trying to get reimbursement, I'm trying to get payment for these people that we treat, I've got to put them in one box or the other. I've got to put them in column A or column B. If I'm trying to get payment for these people coming into a mental health crisis bed, a psychiatric crisis bed, I've got to make a case that I'm meeting medical necessity criteria for that program. I mean, and we know that people pop into the ERs very often. I mean, the presenting complaint that we often hear is, if I don't get help with my problem, I'm going to kill myself. So the suicide risk makes somebody, you know, a candidate for psychiatric treatment. But the thing that's driving much of this is the substance abuse problem. And you have to then treat the person. You've got to detox them so that you can have some sense of clinically what you're dealing with, so that you know, in fact, is there a depression under there? Is there a psychotic process under there? Because we know that people medicate themselves, they self-medicate themselves with illicit substances to manage their psychological pain.
We also know that most people kill themselves under the influence of a drug or alcohol.
That's right.
So that those issues have to be taken very seriously.
That's correct.
At the point that someone is crying for help in that way, it's not a point at which we say, sorry, this isn't the place that we serve you. So the obligation is to bring the folks in. It also needs to be seen as an opportunity. You can, at that point, with that individual, try to tease apart some of these issues and get a better handle on what's driving their depression and, in this instance, their suicide thinking. But you're right, clinicians are forced to make these artificial and arbitrary choices, and you've run programs, as have I, and we both know that if you don't get paid for the work you do, you don't stick around very long.
That's right.
So just another example of where policy is a little out of sync with clinical need.
Well, you know, the interesting thing, I mean, when you talk about that too, I mean, the other thing that comes to mind for me is that there is some discussion going on at this point, in Baltimore City about whether or not there ought to be a combined mental health and substance abuse authority because of the recognition that the lines are often artificial and that people are real and we've got to deal with the whole person.
Yep.
We these days get money from, I get funding from, state and federal mental health dollars, and I also get funding from substance abuse dollars because I've got these various programs. But when we look at the people with problems.
These disorders don't discriminate, and they don't separate themselves out very neatly, and as you pointed out, it's more often than not that the two sets of disorders, addiction and mental illnesses, come together rather than present as pure one or the other. And so in terms of the sort of policies and practical issues around funding, everybody's worried from the addiction side that their dollars are going to get somehow stolen by mental health and vice versa from mental health. And so there's a new concept in policy circles these days where we're not so much promoting blending of dollars where you lose accountability, but rather a braiding of those funding streams so that I, as a provider, you as a program director, we can actually use those resources in a combined way to address both sets of issues in an integrated fashion. We know that if we don't provide care in an integrated way, we're not going to get good outcomes. You can't treat addictions and ignore mental health or vice versa. If you hope for that individual to get on their feet, to get out of homeless situations, to stay out of ERs, to stay out of jails and prisons, you really have to be talking about a more sophisticated, and it's available in terms of the data to support it, a more sophisticated planning and treatment process.
Well, as always, when you join me on the show, I find that we're rapidly running out of time. I tend to feel that we've just kind of broke the surface a little bit in terms of these complicated issues, but is there a number where people could get in contact with you if they were more interested in finding out about this area?
Certainly. Our center is dedicated to developing policy, research, and providing training around these issues, and I can be reached at 410-724-5007.
I want to thank you for joining us again. Certainly your comments were quite thought-provoking, and I anticipated that that's what makes you such a good guest on our show. I want to thank you, viewing audience, for tuning in to us again, and would ask you to remember that if you or someone you know needs help with a mental health or substance abuse crisis or issue, you can call Baltimore Crisis Response Incorporated at 410-752-2272, and remember, your mental health matters to us. Thank you for tuning in. You can call Baltimore Crisis Response Incorporated at 410-752-2272, and remember, your mental health matters to us. Thank you for tuning in. You can call Baltimore Crisis Response Incorporated at 410-752-2272, and remember, your mental health matters to us. Thank you for tuning in. you can call